Hey everybody, it's Randy Justice. Welcome to the live video. So happy to have you guys on with us tonight. We're going to be starting in just a couple of minutes. Many of you that come on the show know my lovely wife Deb. She's going to be joining us here also, and she's running a few minutes late. According to Life 360, she is about six or so minutes away. Sophia, I see you're in the chat room. Mr. Nuke 75, hi. Keith, brother, how are you, man? Glad to have you on board, buddy. It's been a while since we've talked. Oh no, that's Keith. Sophia's not the grandmother we normally have join us on here. That's really funny. Uh, Yeah, that she does. She changes her name all the time. You're exactly right. That's really funny. Um, but it's 6:02. Yes, Sophia, we know we're running a few minutes late, but it's all Deb's fault. And she will be with us momentarily. I have to blame her on everything. But just to tell everybody, man, as you come on, I hope that if you're joining us and you're joining us for the first time, I ask you to like the video. That helps the algorithms get it out to more people. If you're new to the channel, hit that subscribe button and hit the notification bell so you can be notified anytime that I go live. There's a lot of new videos coming your way and a lot of live videos. And tonight we are at Embody Healthcare at Paper Mill Point Way in Knoxville, Tennessee. And in just a moment, I'm going to go ahead and introduce my wonderful guest. As a matter of fact, while we're waiting on Deb, I think that we just go ahead and get started. So let me put them on the screen here. And I want you to welcome Dr. Michael Major and his wife, Melissa Major, nurse practitioner. They are the owners and providers here at Embody Healthcare. And welcome to the video, guys.
Hey, everybody.
Hi there.
To let you know a little bit, I was introduced to Mike and Melissa end of last year, and I had a really good friend of mine who was a former first responder. Told me about them, and they do healthcare a little bit differently, and they work with a lot of people that have some depression, PTSD, anxiety. So we're going to talk about that very shortly. But why don't you tell everybody, as they say, ladies first. We'll do that. I'll put you on the spot, Melissa. Ladies first. Tell us a little bit about your background.
How far you want to go back, Randy?
Well, well, let's talk about your credentials, being a nurse practitioner.
Yeah. So I graduated NP school from Boise State about 8 years ago. Prior to that, I had been an RN for about 15 years. So lots of medical coverage under my belt. Did a lot of
We like Deb out. She's here.
Yeah, so I did a lot of home care, adult and geriatric care has been pretty much focused the majority of patient. So
I'm having to direct Deb around there. You saw her pass by. Okay, she's going to help moderate with questions in the chat tonight.
where are you at?
Sophia says, speak up a little. We'll turn the mic up.
Uh,
Okay. So, Mike, you're the MD here. Why don't you tell everybody a little bit about your background, where you got your degree and
So I was 17 years military. After a couple of years in, went to the military medical school in Bethesda, Maryland. Stayed in for a total of 17, got out. Did about a year of primary care outside of the military. Didn't like it so much. Went back and did inpatient hospital care. I've been doing that for quite a number of years. We opened the clinic up a few years ago just as an answer to kind of the broken system that we've seen over the many years of working in it. And then wanted to dedicate full time to the clinic. So just a few months ago, quit the hospital job, and we've been working clinic full time.
That's fantastic. So Embodies different. It's not your typical healthcare office. What makes Embody different?
Us.
I totally agree with that.
We're absolutely different. As you can see kind of by our outfits, we're not a suit and tie kind of people, dress up people. It's jeans and t-shirts or scrub tops and pants. We've got a sign just on the other side here that we welcome everybody. Everyone's welcome, whether you got insurance, no insurance, black, white, gray, green, doesn't really matter. We're just very accepting here. Kind of the primary thing that sets us apart is our clinic model. Um, the textbook answer is we're a direct primary care clinic. No one outside the business knows what that means. Basically, what it means is direct primary care. So we do primary care directly with the patient. So everything involved in somebody's healthcare is us, you, and nothing else. We don't answer to insurance companies. We don't answer to bosses. We don't answer to administrators. So the whole discussion on healthcare is the two of us having a conversation and coming up what is best for you. Outside of that, we still do have to work with the system on laboratories and imaging studies and pharmacy benefits, but we've spent a lot of years kind of putting together care plans that tailor to uh, folks who don't want to either utilize the insurance they may have, or if they don't have insurance, we navigate them through the process pretty well.
That's awesome. And I can speak as one of your patients. You guys, in my opinion, and in a lot of ways, I feel like that you saved my life, and we'll get into that a little bit more. But so really, 98% of somebody's medical needs can be taken care of right here in office at Embody.
The medical system was really based on primary care as being the foundation of everyone's healthcare. You go to your primary care if you've got a cough, cold, sniffles, pneumonia, high blood pressure, diabetes. What's happened over the years is primary care's time has been limited. Appointment visits used to be 30 minutes, maybe even 45 minutes, but they've had to cut down on that mostly because of the number of patients they have to see per day, and they're forced to see that number. When you're working in the system, insurance companies have really downgraded reimbursements and care for patients and for providers. And so when provider used to be able to see maybe four patients, you know, easily, in an hour or two, now they're seeing, upwards. The standard right now is about 24 patients a day. And when you're opening a clinic maybe at 8 o'clock in the morning and shutting down at 4 o'clock, I mean that's a lot of people you have to funnel through. And so their time and care is very condensed. They don't have a lot of time to really spend with you. They've got to come in, address your one problem, come up with a diagnosis, do all their treatment requirements that they need to do, get you out the door so they can get the next person in. And it's not really the fault of the primary care provider, it's just the system they work in. It's a volume issue. They've got to stay in business, and the only way of staying in business is volume and throughput. Where we base our model on a membership model. We don't deal with insurance. Our we don't answer to anyone else to for reimbursement costs. I don't have to dot all my I's and T's and check a whole bunch of useless boxes on a medical record form to meet some arbitrary requirement. Some administrator has said that this is what you need for quality care. We come in, we dedicate, I mean, our shortest appointment really is a 30-minute appointment. And sometimes that's a quick walk in and out, but it's still designated 30 minutes. Most of ours are upwards of an hour. And that's an hour entirely dedicated to you. You walk in the door, you're put in the exam room. We come in within a minute or two. You've got the entire hour with us for that time. We're not starting, we're not doing a whole bunch of administrative things that is typical in a regular primary care appointment. So we can listen to you, get your history, get the details, really formulate a detailed care plan for you. And that's when you're in the office. We actually pride ourselves that our goal is to keep you out of the office, is to keep you out of clinic. So we do a lot of virtual care. We'll call you up anytime that you need to. We have a text messaging service. It's a secure text messaging service that we use. Say all of our patients actually utilize that. If they're having an issue, they'll text us and say, "Hey, I'm having an XYZ problem. Is this something that I need to come into the clinic to be seen for, or can we manage this over the phone or even through texting?" And most of the time, we can handle it virtually. We don't need to see you in clinic.
We actually, myself and my lovely wife Deb can attest to that because we actually, Deb, just a few months ago, got bit by one of our cats. It got infected, and we actually used the texting app to send you guys a picture of it uh, before we, came into the office to find out what do we need to do. And you guys were right on it and stuff, and it was and that was great. And you decided, yep, she needed to come to the office. We got her in, got her antibiotics, got it cleared up, and it was awesome. And but that was after we had been to the ER and they put her on the wrong antibiotics, and it wasn't getting cleared up at all. And unfortunately, it happens because that doctor didn't spend a whole lot of time with us at all because the ER was busy with emergencies. I get it. And the reason I about laughed out loud a minute ago, everybody that's in here that can see the comments that's going on, you guys aren't watching, but we had a question, and I'm going to out the questionnaire. That Sophia is their daughter. So the question she asked was, do you do colonoscopy? And then she said, asking the man with the ponytail or man with glasses. I do not do colonoscopies. I'm sorry. I am not a medical provider. But that's yes, Sophia that's in the chat. That is their daughter, and really interesting thing. She now works for me. So remember, I've got to see you in the morning at work.
And the answer, that would be a no.
But the interesting thing is that, like you said, you guys do a membership model, which I think is very reasonable. And for employers that want to participate, their employees actually get a discount off your normal monthly rate.
Yep.
And we actually have, I'm not their daughter. Yeah, okay. Uh, but there's several of our employees now are taking advantage of that,
Yes.
and they all love coming here too. And I think that's a great thing for boy, Sophia's really getting out in the comments. Somebody else said Sophia is in fact their daughter.
We do claim Sophia the cadaver on the messenger. She was our office employee of the month, the first month we had it. And after she won it, we quit the competition.
I love it. Uh, but it boy, I lost my entire train of thought. Thank you, Sophia, for getting me all confused, but it's okay. I love it.
Employee sponsored plan.
Yeah, the employee sponsor plan. That's something that like I say, we've offered to all of our employees, and it's been a big hit with them. I know. As a matter of fact, I know that one of our employees today was ended up sick. She ended up sending y'all a message on Spruce. Y'all got her the medication she needed, took care of her. So that's how easy it is because they stay in touch with their patients all day long through that messaging app, which is 100% secure. Nobody can see your information. It's HIPAA compliant. Uh, but you guys also, I know that even when people go to, and people should have insurance for when something catastrophic
Yes.
happens, or if they have to have specialized tests or whatever. But you guys have done something that I think is very neat, and you have reached out and contracted with some specialized places where a lot of times they can get X-rays or MRIs or stuff sometimes cheaper than what their copay is through their insurance.
Oh,
Yes. We have found with even basic insurance plans, if you go into the pharmacy, your insurance may require the pharmacy charge you a copay of $10 for some medication, and that medication may have been out for years and been generic. Whereas if you opt for a cash payment and not use your insurance, you can probably get that medicine for about $4 or even less. So there's many pharmacies that offer that. Um, so sometimes usually utilizing your insurance is not the best and cheapest option. Imaging studies, we have found that sometimes the copay price for your imaging or your deductible that you have with insurance is very high compared to what you could just do a cash payment for. Kind of one example is maybe an MRI study with a certain insurance could be $4,000. Whereas if you do a cash pay price, you may be able to get that MRI for $1,000 or less without the insurance.
Well, that's the thing that a lot of people don't realize is that, if they think about it, when they have to go to the hospital for a specialty study or stuff, it's not just about the copay to the doctor, but most health insurances, what I've seen over the years is they pay 80%. You're still on the hook for 20% of that. So yeah, you're right. A lot of times the cash price is less than what that 20% would be in the first place.
Yep.
But you guys do something very unique. This area, something that a lot of people don't know about. A lot of people are searching, a lot of people are wondering, and you deal with a lot of people. I'm one of them, depression, PTSD, anxiety, anger issues. Not that I have any, but
Yes, you did.
did though. Deb said it right. I had anger issues. I don't have them. I still get upset like any normal person does, but it's not what it used to be. There's not the loud outbursts. There's not the
Phone throwing.
no. There's not that that and that did used to happen. Um, yes, they help me when I'm in stormy weather with my health, Keith. You are exactly right. But where I was going, what you guys, and this is why I came to see you guys in the first place, ketamine infusion therapy.
Mm-hmm.
Why don't you guys share a little bit about what ketamine is, where it started? I mean, ketamine's been around for years, since the 70s, I know.
It has. You go ahead.
It was patented in 1969, actually.
69.
Yeah, as an anesthetic. Was known as the buddy drug because it was a means of providing pain relief on the fields of Vietnam without the risk of decreasing the respiratory drive. For that, it was morphine that they used, and by the time the soldier would have pain control, he would not be breathing. So ketamine came into play because it's a very, very safe medication, and they could give it liberally without any concern of killing the person while trying to provide pain relief. So that was the inception. Since then, actually, it was Gulf War. Um, it was noted that there was a statistical significance to the soldiers that had been operated on with ketamine versus other anesthetics within surgery procedures, and for occurrence of PTSD. So this is where the mental health component and the draw to ketamine came from, as they started noticing these soldiers weren't developing it that had ketamine during surgery. So that was Gulf Storm, whatever, late 80s. And that's when the research began. John Hopkins, Yale University, these are huge academic institutions that spearheaded all of the research. And it has been utilized for treatment of PTSD, treatment of resistant depression. Now there's studies, they're using it for eating disorders, for addiction, for TBI. It's a very widespread use because we're treating strength. So whenever we're going back to the brain for which all the other things are just symptoms. Ketamine works as it promotes global connectivity. So the entire brain lights up under an EEG. And we know that trauma and depression and all of these other brain disorders cause segmented portions of the brain to be on loops, basically. So you kind of get stuck in ruts. And with the excitation of the entire brain, and all psychedelics, most psychedelics work this way. You promote connectivity to areas that had been before partitioned or blocked off from treatment. And so this is where the widespread benefit of ketamine is, because you're going back to the source, which is just disconnection of pathways, basically.
So ketamine, because of course I've researched a lot about it, as you all well know, and regular subscribers to my channel know I research everything. It's just what I do. But and from the research I've done on ketamine, you guys can probably expound that. It literally goes in and ends up building new neural net the neural network, it rebuilds that in the brain. Basically, essentially, it goes in and the worn out wiring in your brain, it makes new wiring. Would that be a great
Yep.
basic explanation for the people? Uh, I can tell you guys before I started ketamine, like I say, I had tried the normal drugs that are prescribed for depression, for anxiety, and number one, I hated the side effects of them. Number two, the depression, they really didn't work. For me anyway. And again, just to tell y'all tonight, this video tonight's for education. We're not here to diagnose, treat, or cure any illness on this video. So FDA, don't get mad. We're not here for that. If you have questions, if you have questions, you can answer medical questions. I can't, but but the medications again, they didn't work for me. I had a lot of problems. My wife, Deb, was the same way. First medication and the side effects of those medications are just, in a lot of cases, horrendous. Our daughter was having some of the same problems, prescribed a lot of medications that just didn't work. And I know so many people that have been through that same thing, and they feel hopeless, even with uh, having a therapist and going through all that. It's just like they were at stuck points. I think that's a great way to put it, and have a great therapist I'm seeing now. And Chantel, if you're watching the video, just want to give you a shout out. But it's just the ketamine. One thing I found was, especially on the depression side, and I've read this in a lot of the studies, and maybe you guys can talk about that a little more, with a lot of people that really have depression, within just a short few hours after the first infusion, that depression really kind of evens out,
Yeah.
where they don't have that severe depression anymore.
Yep.
It can be the case. Generally, within 2 infusions, people are seeing some increase in mood. Um, Functionality is restored before mood. So, very small things people will notice. You know, one thing that I think is a good selling point is that we aren't only providers; we are also patients, and that's actually how we got into, um, you know, giving ketamine as part of primary care, is because of about a decade ago. We had infusions and had pretty robust, I would say within 3 infusions, probably within 2. It was pretty notable. And this was after a lifetime of antidepressant use that, I actually got up, brushed my teeth, the mail, these very small things, which are huge things when you've been, suffered depression your entire life. So that's generally with the first glimpses of that motivation coming back, to have this, these things that you just can't will yourself to do, that comes, and then the mood starts to improve. So I would say generally by the third infusion, people are feeling better.
Yeah, I know that we've talked about that. I'm kind of the exception to the rule, and kind of have the weird metabolism where I remember, Melissa, I remember you telling me that my first infusion was what most people get by their fifth. So I'm a little different. It worked real well one, and I'm glad it did, because I was in a very bad place, and just and this is a story I'll share with anybody. I was actually at a place. Now I didn't have plans to kill myself or actually commit suicide, but I would have those days where I would wake up and go, "Why did I wake up this morning?" I would have those days where where I would think, if I didn't wake up, it would be better. I would work all day and leave work and try to figure out what angle I need to hit a guardrail out at so that the pain, the depression, the everything I was feeling, the nightmares I was having from things that happened when I was in law enforcement would just go away. And ketamine, when I said earlier that I feel like that Mike and Melissa have saved my life, I feel that way because of the difference that the ketamine's made, and not only the ketamine, but even going back and touching on the primary care side of it. You guys have been phenomenal there because I've been suffering with blood sugar problems since 1993, and I don't feel like that the normal doctors who follow the normal medical model took it seriously enough, and they would never treat it aggressively enough to get it down to where then we could find a way to manage it properly. And I know that we had that talk that instead of doing that like most doctors do, oh, let's do it in steps to try to get stuff done. One of the things that you told me, Mike, was, I would rather throw several things at it. Let's get it to where it needs to be, and then we can back off and get to manage it. And 3 months ago, my A1C was 9.3. That should scare everybody. It did me. And I just got my most recent blood work back, and it was 6.0. So when I'm saying they're saving lives, I'm telling you that's how I feel because of what happened to me. So thank you guys very much. And that's what you've done for my whole family and our friends that have come to you guys now and our employees. I mean, everybody says the same thing that you guys are just best the best medical providers they've ever went to. So that should
Definitely agree. So, Sophia asked, what are the chances of addiction to ketamine?
It's a good question.
That is a good question.
It is. Back in the 70s, ketamine was being used in labs and psychedelic research for treatment of depression. It kind of escaped the labs and got into the public scene and society, and was very well known as a club drug. Central K was very highly abused.
Still
Uh,
is.
Still is.
You could use anything.
Oh,
Which
yeah.
led to the government shutdown for psychedelic research and ketamine, and things being bottled up. Any drug can be abused. Tylenol can be abused. Motrin can be
Oh, yeah.
abused.
The dose we give and the way we give it, there is a very low likelihood of addiction.
Well, I think the thing is, the way you guys do it is you do it in a controlled medical environment
Mhm.
where you know what you're doing. You've been trained on how much to give and what can happen. And with the infusion, I know too, um, because people, and I get this question a lot. Well, have you ever had a bad trip? Because it's called tripping is what people call it because especially used in the club scene, they would take high enough to have hallucinations and everything else, and it's not like that in the medical setting. Now, people can have some of those things happen, but when you're doing the infusion, and correct me if I'm wrong, but you can try take that dose up or down so that if somebody's having a bad trip, you can bring them off that because ketamine's pretty fast on and pretty fast off
It
when
is.
it's given intravenously.
Correct. On the outside, most time ketamine's taken as a tablet or something you put in your mouth or suck on sublingual absorption, so it can have different reactions or onsets.
Way
But
higher
but
dose.
but we don't know what doses those are.
Yeah.
They're not monitored, so who knows what you're getting kind of on the outside of a medical system. But yeah, definitely we monitor. We know exactly how many milligrams you're getting over what time frame. We can adjust the dose up. We can adjust the dose down. Our goal is to give you just enough medicine to get the therapeutic benefit during your treatment.
And I don't know, from my perspective, I guess having had what someone might refer to as a bad trip, really, I think it was just intense.
Mhm.
The emotions that I was feeling, um, some of the trauma that was being processed, and I don't refer to it as bad. because it wasn't bad.
Yeah,
It was needed.
that's how mine are.
Yeah. So
They
it,
are
yeah,
heavy. They're
yes,
heavy.
it was heavy.
Yeah.
Right.
So, and those are honestly, we've been doing this for about 2.5 years. We've probably given over 200 infusions. Those are by and large the most effective long term
Right.
because you're tapping into that space that you have been avoiding because it feels heavy.
Exactly.
So, where you're entering is where you've been avoiding. So, it's not going to be always pleasant. It may just feel intense. I mean, that's a great word too, an intense
Right.
stroke. Um,
Because yes, it was very intense, but I know I got a lot out of it.
mhm.
But we're there. We're in the room. We're right next to you. I mean,
And
it's
they,
not something you're doing alone. You're in a room. It's the two of us. Maybe you've got somebody else as a comfort companion that you might invite in the room. But we're there. If we're seeing that you're having a rough time, we'll talk to you. We'll engage with you. We'll see what's going on. We'll see if we can talk you through it.
and yeah, I can vouch for that too. Yeah, they more than awesome.
Yeah,
Well, it's really interesting, when they talk about that, having somebody in a room with you. I have actually, there's a lot of people I know that I feel like would really benefit. And just to let you know too, ketam- ketamine by itself is not going to solve all your problems, just
thank
like
you.
anything else. It does take, you need to have a therapist or somebody that when there are things that's going to come out and things that's going to come up after you've had a ketamine treatment that you're going to want to talk about because you have to,
Mhm.
and things you're going to have to work through. So ketamine therapy with traditional therapy, or even I found just sometimes, having Deb to talk to, or just having somebody else. Hey, I just realized this because you'll have revelations of things that'll come up that I didn't even realize I was holding at, or I didn't realize I was doing it. I had after one of my infusions, I remember that it came to me that one of the reasons I've been so angry, I had was really hurt by something, and I had been holding it against somebody, didn't even realize I was. But it came out right after the ketamine infusion, so I was able to go to that person, tell them what I felt and what was going on, and then and Brittany's joined. Hi, Brittany. And but I was able to go to them and clear the air, and our relationship's better for it.
Yeah.
So those things are going to happen, and so the therapy component is very important to me, or at least having somebody that you can work through those things and somebody you can talk to
Yeah. Oh, I
about
agree
it.
100%. It's the processing, So ketamine, we think of it like a snow globe. So it shakes things up, things that have been almost flatlined, settled. Um, it's kind of how we feel generally when we get to the point where we realize, traditional therapy is not working, and we find ketamine. So we come in kind of flatline, kind of like a snow globe at rest. Ketamine comes in, shakes up those pathways. So trauma causes neurons to shrink. So those neurons, and this is, I asked about this earlier. Those neurons glutamate, is that's excitatory neuron in the brain. That's what scaffolding of neurons is made of. And ketamine causes glutamate to be, it's an uptakes glutamate. So then those neurons are actually, and we have a video on our website showing real time those dendrites growing on the neurons. So as they grow, then you reestablish pathways, new pathways. So for about 8 weeks, you have that regrowth. This is the prime time to form new habits because you feel good, you're making new pathways, and enter the therapy component. And you are really setting yourself up for the best opportunity to, exit that 8 week period where there. So it's a catalyst. Ketamine's a catalyst. So it starts this growth, and that growth lasts for about 8 weeks. And as you're unpacking or processing, things come up. I encourage people to be curious about memories that may just surface out of nowhere. Why am I thinking about that? And then those are the things that you take to your therapist, and then you just tease it out, and you find out these things that have been repressed and buried because we couldn't honestly address them or handle them at the time. Now we can. So, and that's the beauty of the therapy component, which we are 100% in support of, because sometimes those things can be big and heavy, and if you don't have someone, then it can be kind of unsettling for people because they don't know what to do with it.
And you guys are actually developing a kind of an all-inclusive practice here where you actually have, if I remember correctly, you have a couple of therapists that's actually going to have office space here starting next month.
We are. We've got at least two that are coming in to work with us. They'll be independent, kind of on their own, but definitely work with us, and we'll work with their patients, and maybe on the medical side, and they'll work with our patients on the psychiatric side. So, but we're big believers in kind of the mind body connection. We think that you can't fix the body if the mind is broken, and you can't fix the mind if the body's broken. You've got to treat everything together. So we're very much into the holistic and kind of whole person treatment.
And I totally agree with that. I think that what you guys do is very important. It's I've had people tell me I should become your spokesperson because I brag about you guys all the time. Well, it's just the fact of what you guys.
One of our ketamine infusion rooms is dedicated to pictures her and
Well, clever.
And that really, well, thank you. That humbles me more than you guys know. I mean, it really does. But yeah, I sing your praises all the time. As a matter of fact, it was interesting. I was at lunch the other day. I was at Wasabi, one of my favorite places to eat, and I overheard a conversation. The guy was talking about, man, I really need to go to my doctor. I'm run down. I'm wondering if my testosterone's low. So I carry you guys' cards with me. Matter of fact, guys are probably going to call you because I said, "Hey, I'm sorry that I was eavesdropping on your conversation." But I was telling him, and that's another thing they've helped me. My testosterone levels were horrible. They were at the lowest end of the spectrum, almost below low. And matter of fact, I did bring my waist lab work with me. Y'all can see in a minute. But we need to back off a little bit now on my dose. It's a little high now, but that's okay. We've corrected the problem.
it's
Where
corrected.
where is this has been going on? Another thing that's been going on with me since at least, oh my gosh, 1998. That's the first time I was really diagnosed with.
Researching like what anomaly is this in Randy that
Exactly.
suffers from
But
so
so
much?
why in the past I don't know if I was just not given a high enough dose. I don't know what it was. But when we threw the dose and stuff you guys did and we got on the injections and everything happened, now it's over 1,000. So but it worked and I feel better and it's great. And Deb thanked them for it. So that's a whole other matter we can get into. This is a PG video.
Yeah, yeah. Thanks for embarrassing me.
You're welcome. You be on camera?
Yeah.
Watch on camera.
Not even hardly detectable.
Exactly.
Very long either.
No, 6 weeks. 6 weeks. And it went from,
Yes, I like it. It just everybody else was okay. Let's increase it a little bit and see how it does. And yeah,
yeah. And so,
Uh, yeah. Brett said, "Ew, that was good."
It's set to do stuff too.
I'm just.
oh, yeah. Yeah.
That just goes with
But
capability of follow-up.
It does.
yeah.
Kind of in the established practice, when you call and try and get an appointment with your primary care, it may be several weeks, more often a month to 3 months before you can get back in for an appointment, and they need to see you for that. So they're very judicious, very minuscule
There's
with
liability
with their
too. They can't
doses.
leave.
So they'll get you on a treatment and say, well, follow up with me and we'll see how you're doing. Well, your follow up may be weeks to months down the
Oh,
road,
gosh,
and they
yes.
can't adjust it. Whereas we can, on blood pressure management, we have patients just take a picture of their blood pressure log weekly, text us. We look at it. Yes, great. Oh, those don't look so good. Hey, let's up the dose. Boom, new prescription sent. I don't need to have you in clinic. That's all managed on a weekly basis.
Yeah, that's another thing. I forgot about my blood pressure too. That's a thing that the blood pressure medicine, and I've been on it for a long time and it had worked up until it didn't. Whether my body got used to it or whatever, and so we saw my readings and stuff, and y'all changed my medications, everything. Now we've got that down. I think my average the last when we averaged it out was like was like 128/83, and it was a whole lot higher than that before we started. So again, when I say that I feel like you guys have saved my life, that's how I feel. I feel like you've done so much for Deb and Brittany and just our friends and coworkers that we're forever thankful. I mean, we just are, and that's why I wanted to do this live video and just to try to get the message out about what you all do and how you all have helped all of us.
Well, we try and treat our patients as family. You know, when you enroll to our clinic, you're not enrolling to basically a medical clinic. You're enrolling to like a medical family. You know, we kind of say we're like having a doctor in the family. We can call Uncle Dr. Joe and see how he's not that Joe, Dr. Joe. And, and get some advice. You know, that's how we want you to be with us. If something's bothering you, send us a text. If you need help with something, send us a text. Yeah, we'll help you out. But that's what we do. I mean, it's kind of we don't see it as patients, but as your family members once you're here.
Well, and that's exactly how we feel. I mean, you
It
guys have
is.
made us definitely feel like family, and it's just, it's been an awesome experience. Is there anything else you guys would like to share? Anything you can think of that maybe we've left out, or
Mm,
Yeah.
we?
Well,
And
I thought Britt, she just posted a comment. Thought I'd share. I had zero quality of life before coming to you guys, if I'm being completely honest.
Wow.
What a chef now.
she's definitely got a lot better quality of life than what she
Definitely.
had.
Yes.
And there again, I feel like that. Um, and that's just, wow, it's just, I get emotional when it comes to my daughter. So
Yeah.
sorry about that, guys. But not, no, I'm not sorry. My daughter and I love her. But
She is a different person.
she is, she's awesome. She's a mini me, unfortunately. I'm so sorry. World, I'm sorry. You got to put up with two. You got to put up with two of us. But Britt, I love you, and you know that.
We love
Uh,
her. She's
but
come a long way.
she
Because
has.
you can tell, like, she did the hardest work.
Sophia, blood is not blue. Quit it. You gotta love her though. She's just so funny.
The arguments we have.
Yeah. Yeah.
Seriously.
Just wondering when question time is. Kind of afraid of
Oh.
what she might ask.
Yeah. I'm kind of worried about them too. But so we don't have many viewers right now, unfortunately. But that's okay. People are going to watch this video later, and I highly encourage you if you've not been on live with us, if you see this video later, because it's actually going up on my very first podcast that I'm doing. So if you see it and if you want to get in touch with Mike and Melissa at Embody and Stuff, tell them how they can do that.
Primary way is on our website, which is embodyhealthcare.com, letter M, BODY, healthcare.com. Click over on our contact page, fill out the information, sends us an email. We get back to you pretty much the same day, give you a call, give you any information that you need.
Yeah, and one thing I can say too, because, and we didn't think to mention this, because of your direct pay, direct care model and stuff, you guys have limited the number of patients you have too. Is that correct?
We are. I mean, we don't want to become the established system where we have so many patients that we're just funneling through. So most direct primary care clinics actually cap their patients. Just to give you an idea, some clinics will cap it at about 500 patients, and say that's enough. Kind of your typical primary care working out in the system has 2,000 plus patients that they're trying to take care of.
Your daughter's something else. I'm just going to say that.
Med school in a couple of years, and this is gonna come back to get her.
Wait until you go back and read her comments. That's all I'm going to say. It's awesome. Oh my gosh. I'm becoming very fond of her. She's awesome.
Power to fire.
Yeah. Keep that in mind.
Can't.
Yeah.
You can't.
Yeah, but if I fire her, then you got to live with her hearing about it, right? That's awesome. So let me ask you a question. Do you want to give people a tour of your clinic real quick, or
Yep, that's
we
fine.
can
Go
do
for it.
that. Let me get the portable camera on. Come on now. Yeah, I had some
It's
tech.
proof that blood isn't the flu.
Okay, she
I don't
does.
think we're going to be drawing any blood or anything like that right now.
Only time blood has been blue is when you administer methylene blue and it
Oh, that's very true.
colors and dyes it.
Well, there you go.
It's the main color.
Well, there's a whole other. Well,
What?
hang on, man. I got to kill the feedback. Okay, feedback's killed. Sorry about that. I apologize very much. Um, so, so we got the portable cam. Their waiting area, as you guys can see. I see a body logo over their heads and stuff. Nice reception area where normally Jill is here, but she's not here right now. If she's watching, loser, you should have been here. Jill, sorry about that. But y'all want to walk through, give them a tour, and so that way you guys can kind of see what we've got going on here.
It's a much bigger office than what we had before. Our last office was 3 rooms. One office, one exam room, and one.
Your fingers over it, Randy, where it was.
Say, oh, it's delayed there.
Oh, okay.
So
My bad.
we've expanded out. When you walk in, these are all family puzzles that we put together. Some of them have missing pieces, just because that is life. Sophia probably. We had cats. So come on here. Nice little bathroom. Yes. Let's do some maintenance box. But here we got pamphlets and different things that we offer. Anyone who drop a business of a card off for medical referrals. So there and now. Oh, this is our wall of art. Mostly Sophia. It's all Sophia. So this is right here. Was sitting in my clinic one time and drew this and said, "I'm bored." She seems to get bored a lot. She does. And then our back hallway, got a number of offices down here.
Those two got it. Man. Seem like so. How hard of him was that?
Got a very nice little
I know. How?
Wait.
She's hilarious. She said, I'm gonna be funny. I said, be funny, but be nice.
She's
Spa.
Cohen products. I don't know. She's funny.
At least she went up there. I guess she gave us some laugh.
They can hear us very well. I just got, Mom, we can hear you from Sophia.
Sorry. My bad, take care. Tell me how they can hear anything on the top. It's too on the flash.
She said, Mom, stop calling me that. I guess
Yes, y'all read that song correctly. Sure, that's okay. What a lot of people don't know is it's really interesting. So a lot of y'all know I'm a Star Trek fan. Well, I'm a Star Wars fan. So we won't try to be best.
Yeah.
But
So his,
they do. They do.
they keep
That's kind of true of Empire. Well, guys, that was kind of a tour of Embody. Again, if you're watching live, that's awesome. If what would you call Sophia? That's what I want to know.
to tell you later.
uh, anyway, if you're, whether you watch this video live or whether you watch it later, I would love to invite you guys, reach out, embodyhealthcare.com, the letter M, BODY, healthcare.com, and just check out their website. You can read more about them, find out what's going on. And, I encourage you to reach out just for come for a visit, a consultation stuff. That's what me and Deb did the first time. I think we spent about an hour and a half talking to you, Melissa. And it was no, we did it together, so it was
Yeah,
good.
but
But we felt so comfortable that it's something we wanted to do, and we originally came just about the ketamine because I knew I needed help with my anger and the depression and everything else I had going on, and it's just turned.
Gosh, that seems like so long.
Doesn't it though?
It's come in
Yeah,
quick.
that's what it was, and it's just turned into so much more than that. And again, I owe you guys a debt of gratitude. And something I wanted to mention too. You had talked about this. I mean, you have especially is doing a infusion video, and I have I volunteered to be the one that's on the video. I promise I won't be goofy on it. That does happen occasionally. Well,
If you put a Star
but
Trek theme song on while he's doing it, he will.
yeah, we'll do something a little different. It'll be. I promise I won't. Yeah, it. But and I don't know how you all feel about it. How would you feel about doing a live infusion? Okay.
That's absolutely up to you. So.
Okay. Yeah, I have no problem with it. It's something me and Deb have talked about, and I would love to do that. So, guys, I will schedule an infusion so you guys can see it. And of course, I will post it up so you guys will know when it's coming, and everybody can join us live, and you can actually get to experience what happens during a ketamine infusion. Unfortunately, you won't be able to see what I get to see,
Yeah.
but you'll get to see what happens to me and maybe hear some of the things that comes out of that. Um, uh, sometimes I'm very talkative, sometimes I'm not at all. So it just depends. Every session's a little bit different. But anyway, thank you guys for joining very much. I guess I'll ask. We only have 2 viewers, so it's got to be. I don't know who's.
I don't know.
I don't know who's
There's three.
left.
There's three now.
Oh, there's three now. Okay, mine's not refreshing as fast. Any questions, Keith? You have any questions? Anybody have any questions before we go? And we'll wait a second.
Not Sophia though.
Yeah, not Sophia. You asked some really inappropriate questions,
That's so.
which we're going to talk about tomorrow at work.
You should make her research them and then address the answers to the group at work tomorrow.
Well,
Mm.
there's one she asked. I don't know if the group wants to know. Oh, no. Hmm.
Well, no.
Colonial prolapse was a process that happened in pilgrimage time. when the English tried coming over, and it predated 1776. That was the colonial probe.
Well,
That's
there,
Learn
awesome.
your history.
there you go.
Oh, well, there's your there's your answer for that, and it has been an absolute pleasure. Thank you guys very much for doing this, and thank you for allowing me to come here and do this. And again, no matter when you guys watch this video, it's wild. We've been on air 55 minutes. It doesn't seem like it's been that long. But we'll definitely do some more. And again, I will we'll schedule the infusion, and I'll post it when it's coming up. And we'll try to get the word out to everybody so that you guys can join us and watch a live infusion. Anyway, I hope everybody has a great night, and I will